Why do you want to? There are several questions on that. Today is the answer. I'm sure by the time we get out of here, you will all come back to me and acknowledge the reasons why we have to celebrate International Men's Day. We have experts around who would be taking us through men's health issues and enlighten us. We will also have a chance to interact, ask questions of things that are not clear to us. Thank you very much for listening, and thank you for coming. Welcome once again.
I just want to do a quick test to see how much we already know about prostate issues. In fact, this talk, when I gave it, I talked about prostate issues and other men's health problems, but I have removed those parts from here. So we're just going to talk about prostate issue and the testicular issues. So it is on the board. What is the prostate? And who can hazard a guess? Just one guess. Out of these 5, which one is the correct one? Who wants to just say? B. Okay. The correct answer is it is in the pelvis, just under the urinary bladder. All the others are wrong. What is the function of the prostate? Who can hazard a guess again? Did I hear B? The correct answer is actually E. Okay? It provides the fluid where the spermatozoa bathe and also some of the nutrition for the spermatozoa. Which of these is a common symptom of early prostate cancer? A, and some people will agree with this, is that there are no symptoms, and you have to be very careful because early prostate cancer comes with no symptoms at all. What is the PSA test? B? Okay, so let us go on. Somebody has answered it. Yes, only indicates prostate disease, not necessarily prostate cancer. I think this man is jumping the gun. And I will ask him the next question also. Let's go. What is the answer to the next question, even though you haven't heard the next question? Is it A, B, C, D, or E? You'll pass. Okay, I just wanted to see how observant we are. We started with E, D, C, B, and of course the next answer will be A, isn't it? So let's go next question. Which of the following is not a possible direct side effect of treatment of prostate cancer? It's bladder cancer. All the others can be caused by treatment of prostate cancer. So, what is the absolute difference, the only absolute difference between a man and a woman? We've been talking about men and women here. Is it because ladies don't have testes? No, because ladies have also something that is akin to the testes, which is the ovary, isn't it? Is it because they don't have a penis? I'm sorry to say. No, they have something that is very akin to it. And is it because they don't have a prostate? Yes. It is the only thing that, if you really look at, distinguishes us from men, from women. So I always ask myself, when I look at this picture, this cross-section of the prostate, looks very much like an apple, isn't it? And I ask myself this question: is it a reminder of eating the apple that we were not supposed to eat? Next, please. So we go to the basic things. The prostate has several diseases. You can have a BPH, you can have prostate cancer, and you can have prostatitis. I just skimmed through the BPH because that's not why we are here today. I think I was asked to talk about breast cancer. But BPH, the reason I'm talking about is that whenever you say prostate to men, they think it is cancer. You have a prostate problem, they think it is prostate cancer because people think that it is the only disease that you can have in men. BPH is actually far more common than prostate cancer. And about 1 out of 3 men, by the time they're 60 or 70, will have problems with their prostate in the form of BPH. The symptoms, I would like to just explain it this way. This is a gentleman who was in my clinic, an old man who had come to see me, and he was with a young man. And the young man was very talkative. kept on asking all the types of questions. What are you here for? What are you doing? Why are you seeing Dr. Ja? And all that type of thing. Then the old man got fed up, and he just told him that, look, young man, the reason I'm here is because my bladder is as active as your mouth. And that is actually what the prostate does to you. It makes you go very often to pass urine. It becomes very urgent. You cannot hold it. Once you want to pass urine, you're going to go and pass urine. Basically, these are the main symptoms that it gives you. And the doctor will do a digital rectal examination, which I told you about. Okay, it's a very uncomfortable thing, both for the doctor and the patient, but you have to bear with the doctor to get that done because it gives a lot of information. If you have these symptoms, should you ignore it? Or is it possible just to say, I don't need treatment? Yes. It is not always necessary to treat prostate disease. Some people can get up 10 times in the night, it doesn't matter to them. Some people get up only twice at night and it spoils their whole day because they cannot sleep again. And it depends on how much bothered you are about it. But you should always report to the doctor because sometimes you may not be bothered about it, but it may be destroying your kidney. In some people, it doesn't cause that problem, but in some people, it can. So you see your doctor. If it is not causing you bother and it is not destroying your kidneys, then you may as well just leave it like that. Treatment options, we have Dr. Baji here who will talk maybe possibly about the medical treatment, but you can have medicines and you can have also surgical procedures. Nowadays, thankfully, the surgical procedures are all minimally invasive. You can do your prostate in a minimally invasive fashion, and that is also available in the Gambia as we speak. Prostate cancer. It's just a cancerous lesion in the prostate. And it is quite common, not as common as BPH, but it's common. And by the age of 80, we know that 8 out of 10 men would have some form of prostate cancer. Whether it's an aggressive one or not is another thing. And men usually live and die with it rather than dying of it. The early symptoms I have told you, mostly there is nothing. If you have urinary symptoms, it's most likely due to a BPH. But you can have a BPH and a prostate cancer at the same time. The doctor will do a physical examination, will do some blood tests, and then we'll offer you some treatment if it is necessary. Next. Is it always necessary to treat? Somebody like Nelson Mandela had it, survived it, lived and died with it. He did not die of the prostate cancer, he died of chest disease, although he had prostate cancer. There are other famous men who have survived prostate cancer. Colin Powell is one of them, Roger Moore, the actor, Robert De Niro. And there's another Gambian, very famous Gambian, who has survived it, who has talked about it in public, and that's why I have the bravery to mention it here, and you'll hear from him. Treatment options. Again, prostate cancer has a lot of treatment options, especially early prostate cancer can be cured. It's one of the cancers that can be cured. But late prostate cancer cannot be cured, but it can be controlled also. So it's one of the good cancers. And the treatment options will include tablets, injections that you can take, surgery in the form of minimally invasive and proper surgery, so to say. Nowadays also you have robotic surgery that can be done for your prostate. Testicular cancer. It is not as common as prostate cancer. Just like you can see, it's 1 in 250 men that have it. It also does not happen in elderly men. It happens in young men from 15 to 35 years old. So now I am sure I will not, since I didn't get testicular cancer, I know I cannot get testicular cancer again. Somebody above the age of 40 is very, very unlikely to get testicular cancer. So it's the cancer of young men. So the people we should talk about, these are our children and our younger brothers. I'm sure some of you here are less than 35, so you should still watch out. And again, it is one of the cancers. Most of the cancers, if you ask about them, they are more aggressive and they are more common in black people, like prostate cancer. Prostate cancer is more common and more aggressive in black people, but testicular cancer is more common in Caucasians. What are the risk factors? There are no risk factors. We don't know what causes testicular cancer. We don't know it at all. And therefore, anybody is entitled to get it. One of the risk factors that we talk about is when your testis doesn't come down in time. that person has to be more careful. Or if you have testicular cancer. Symptoms is just lump in the ball. And you have to know how it looks like. That is why I put the picture there. A lot of people come and say, I have felt a lump. And it's not actually a lump. It is just the normal anatomy. You see that bulge on the upper and the posterior side of the testis is called the epididymis. And it is normally there. And sometimes you can have actually lumps in the epididymis. Those ones do not represent testicular cancer. Testicular cancer must be on the body of the testis itself for you to say it is testicular cancer. Early detection is what we talk about. Prevention, you cannot possibly prevent testicular cancer. So we talk about early detection. And that is why you are allowed to touch your testis sometimes. The same way we tell ladies that you should touch your breast and be familiar with your breast, you should also touch your testis and be familiar with your testis, so that if you feel something that is not there, you can present early. So if there is a cancer in the testis, what do we do with it? We remove it out of play. So you remove the testis altogether. Luckily, you have 2 testes, and 1 testis is enough to do the trick. After removing the testis, you may need chemotherapy, you may need radiotherapy. I think maybe Dr. Baji will talk about some of the chemotherapeutic agents. Prognosis for testicular cancer, again, is excellent. If you discover it early and your testis is removed, you are cured. I cannot count the number of young boys that we have done, removed one of their testes for, and they are cured now. They are walking around in the country. And they will live a normal life. They will be able to marry, they'll be able to have intercourse, they'll be able to have children with that 1 testis. So it's excellent if you discover it early. So we should talk to the people who are at risk, which is the age group I have talked about. Even if it is a late disease, and you have all the modalities of treatment, that is radiotherapy and chemotherapy and the surgery, the outcome can be very good in 70% of cases or more. So in conclusion, you may as well know that you are the weaker of the 2 sexes, and you should inform your wife early. Then you will rest. Thank you very much.
I'm going to begin my conversation to talk about the holistic things, a bird's eye view of our health system, in terms of continuity of care, in terms of establishing a primary doctor that at the minimum, every single year you see a doctor, in terms of electronic health records, where if you do present to Dr. Jai when you're 60 years old, you have an active record of what has happened in the past, right? So all these things I mentioned it because I think it's very, very important when we talk about cancers that affect men. In the Gambia, for example, statistics, the World Health Organization's global scan tells you that liver cancer is definitely the most prevalent in Gambian men. Number 2 is prostate cancer. How many Gambian men know that, right? Second thing I want to bring to people's attention is the average lifespan of a Gambian man, the life expectancy, right? Gambian men, majority of the times, don't live to be 65 years old. Prostate cancer normally affects men in that age group, right? So if we're not living long enough to manage the condition, it always calls for us to also peel back layers of our health system to see how, one, we could improve the quality of life of men to live longer, because the women in the room, you guys are living longer than we are. That's a fact. It's anywhere between 63 years old to 60 years old, the average lifespan of a man in the Gambia, right? So I just bring those highlights to kind of bring up the holistic point of view in terms of how cancer is, because Dr. Jem mentioned something very interesting about treatment. So my background is, I'm a doctor of pharmacy. It comes to, okay, what happens once the test is confirmed, which requires technology that may not be readily accessible in the Gambia, right? So how do we create systems in place where now, even if doctors do want to screen somebody for prostate cancer, getting a PSA test doesn't require a Gambian going to Dakar or overseas to get the test, right? So all those things are things that I want to bring to you guys' attention. But from a medical standpoint, I think one of the biggest things is hormones play a lot of role in how prostate cancer is handled, right? The other aspect is either you change how the hormones in your body are working, where it slows down how fast your prostate is growing. Or if you look at it in terms of symptoms, you start using an agent that could relax the muscles in your, to make sure that you're easily able to go to the restroom, right? So from a pharmaceutical standpoint, that's a lot of things that we use to assist the urologist. Those two options, hormones or creating ease of incontinence, right? But that also goes back to, okay, how readily accessible are these medications for the doctors to prescribe them in the Gambia, right? If it's chemotherapy that's required, what system is in place to make sure if the chemotherapy causes alopecia, which is loss of hair, what agents are there to help with that after recovery? If the chemotherapy causes excessive nausea and vomiting, what agents are medically available to support those treatments? So I think from a pharmaceutical point of view, it's really important to see, one, what your options are, but two, to also understand that the doctor mentioned something really interesting in terms of prostate cancer, which they call it watchful waiting, meaning assessing if a 65-year-old man, how aggressive do you want to do with the treatment if his life expectancy is not as long, right? But watchful waiting cannot happen without a system where there's continuity of care, meaning regular doctor checkups, meaning getting that digital rectal exam, meaning if the doctor requires a PSA test, right? How easily accessible is the PSA test, right? So I think the challenge for us, from a healthcare community, is how do we, one, sensitize, which it starts like events like this, but also how do we start pushing the conversation to make sure systems are in place for men to readily have access to know what to look for. And if it comes time to, he mentioned BPH, which is also very common, especially in black men, knowing what treatment options look like, right? So in the spirit of the cancer conversation that we're having that relates to men, I really think our biggest opportunity specifically for the Gambia is utilizing technology. That's one, because tests, electronic health records, collaboration, where now as the pharmacy industry could collaborate with Dr. urologists locally, internationally through telemedicine, and create access where now we could find out how effective the cancer treatments are, but also how effective is it within the Gambia context, which you always have to realize it's access, quality, and cost. Any individual who's gone through chemotherapy, the first thing they'll tell you is it's expensive, right? So that brings in what's the government role in terms of creating subsidies for chemotherapy agents. From a pharmaceutical industry standpoint, what's the industry doing to make sure physicians and doctors have access to the drugs that are proven to be effective, right? So there's a lot of layers to how you could treat one problem, especially when it comes to prostate cancer and testicular cancer, right? But I think it always begins with, one, connecting everything that's involved in the disease progression and making sure there's systems in place to have those conversations. So if there's one thing I want to add to what Dr. Jha talked about, is one, there's always treatment options, but the treatment options normally is not aggressively sought after. There's pharmaceutical agents that could make symptoms be better, which is readily available on the market. Efforts should be made to make sure those are readily available in the Gambian market. Because it's a Gambian event, it's Gambian men. These are conversations that I believe that we should have, right? So I think that's the take-home message, at least from my perspective. Pharmaceutical agents are available, right? But us as Gambian men, we have a saying most of the times in our health system that most men only show up to the doctor if something is bleeding, burning, or broken, right? As men. Women have a higher pain threshold than we do, right? And testicular cancer and prostate cancer, like the good doctor said, there's no symptoms. It's our mindset, right? So those are the things for men. I challenge you guys to have these conversations, which your loved ones the young men who are in that age bracket, so even if the statistics is 1 in about 250, right, still have those conversations. And that digital rectal exam, as comfortable as it is, once you get to that age, make it a priority. Thank you very much.
I was asked to do a medical test. So I did a medical test here with Dr. Senghor, and he discovered that I was borderline being hypertensive. So my systolic was reading about 160 at the time, and then my diastolic was about 95 or so at the age of 40. So he said, look, I think you are hypertensive. I mean, you are at the borderline at your age now. By the way, I mean, I come from a family of hypertension. My dad died of it, my mom died of it, you know, 2 of my sisters died of it. You know, so moving on, I went to the UK, did a test, and it was confirmed. And guess what? I started taking medication. I'm 62 now, so you can imagine for the past 22 years, I get up every morning and take my medication. And again, further down, people look at me about my size and think, oh, but you're looking younger and slim. But you know why? It's my health. So I jog and walk every day 10 kilometers. You know, so I'm very health conscious. I need to control my weight. So from a health point of view, not only this I talk about all the time, I love the tight fit also. So if you want to have the tight fit, like some of these guys, I'm sure your tummy will be bumping out. You need to be fit. It's nice to be fit. And that's fashion these days. So then that happened, and after that, I kept, you know, making doctors my friend. So every time I go to the UK, I go to Harley Street. And now because an insurance was taken on me, I went into Bupa, you know, Bupa International. So every time I go into the best of medical services, Bupa will take charge because it's expensive. So fast track. 11 years ago, I went to see my doctor because every time you see a doctor, I mean, these doctors didn't tell you about this. At our age now, or well, at 40 and above, please check for hypertension, diabetes, and for men, prostate. For women, breast. It's vice versa. You see, I've now adopted to be a doctor. I can tell you more than these 2 doctors here. So when I went to see my doctor, who was my friend, I mean, and he was a consultant or he's still a consultant in Harley Street, a Jordanian. We started chatting, you know, Dr. Jack told you the awkward bit of testing prostate. You know, basically what the doctor does, he takes his finger and goes through your anus. That's what he does. He didn't tell you. He was trying to be more diplomatic here because the ladies are sitting at the back. You know, ladies need to excuse us when we talk about this. But this is the reality, and Dr. Abaji also said the same thing because, you know, they ask you to put your pants down. Can you imagine as a guy? So that happened, and I regularly did this. But this time I went in, and he told me that, well, Mustafa, I think I feel something awkward here. So he sent me to do the PSA. That's the next step. The PSA is a urine test. Very simple. Once it's done, then the markers are there and they can tell whether your prostate is enlarged or not. But to confirm their point, I never had any symptoms whatsoever. I didn't even do any frequent peeing at night or so. I never felt anything in my life. So he did the test, and it was again something like borderline. So again, he did another advanced test, you know, blood was done, you know. But somehow, every time it's done, you know, I am at a borderline. So I wanted to come back home and say, you know what, let's take some samples, you know, and then it will be tested. This was in the biopsy. And then he said, so go home, and if there's anything really serious, we'll call you up. So I flew into Banjul. It was on a Friday. I was sitting at my mom's in Banjul and having my Benadryl. And my doctor called. The moment I see the number, I got shocked. He said, Mustafa, my friend, I think it's good. When are you coming to London? Actually, he's very diplomatic. He said, well, I don't have any plan. He said, well, anytime you come to London, I think you should come back. So I said, doctor, I'm on the next flight. So I jumped on board the flight and went to see him. So when I went, he said, look, let's do a biopsy. You know what a biopsy is? They go in, you know, again, through your anus, and then take, you know, tissues of your prostate. So normally they will take about 4. But he said, look, just to be sure, let's take 8. So he did it, and then 8 was done, and only 1 came out positive. So very likely, if he took 4, he would have missed it. And he said, well, now the other bit you need to learn is about breaking now the news. My doctor had to break the news to me, and I'm sure doctors are trained to do this. So he had to be on a Saturday, because we were friends. So he said, well, Mustafa, my friend, I'm sorry, but you have cancer. Just imagine today, if you were told that you have cancer, what would you feel? Next thing you start thinking, oh, inheritance. Oh, boy, this sweet ball, I'm going to miss this ball now. So, but let me link up as an entrepreneur how I take challenges. It was a challenge. Something has now broken, so I had to deal with it. So I asked him, he told me, and it took me about 2-3 minutes, to really feel the pain. Thinking, wow, this is it. But then I jacked up again, sat up, and asked him, yes, well, doctor, what's my choice now? What's the next step? So he gave me 3 different options. He said, look, I think it's just at the very beginning. We can give you some medication to slow it down. 2, there's a new discovery, but I think we haven't perfected it yet in curing it. But the 3rd one is to do a surgery. Men don't talk about the surgery. They're scared of it. You know why? Because it's a nerve. I'll tell you in advance how mine was done. But it's a nerve-sparing surgery, and you can lose your manhood. That is why men will die of it without doing it. So it's a big risk. So when I looked at it, he said, well, I said, doctor, look, you know what? I'm going for the surgery. He said, are you sure? I said, of course, yes. So he explained to me, mine was an advanced prostatectomy, meaning robotic. So I went and did the research, what it does and everything, So just fast tracking, I don't want to go past my time. I went in for the advanced prostatectomy. The advanced prostatectomy, actually, what happened is, you are on the operating theater, on the operating bed like this, and then horizontally or at an angle, the doctor doesn't touch you. He put his finger on a computer, and what it does is a nerve-sparing surgery. Because he goes in there, and very, very advanced, but I don't want to waste my time into the details. The nerves are moved, and then they will now get that prostrate, cut it out, and take it out from your belly button. So if I were to take off my shirt, what you see are very pinhole, cuts on my tummy. So they go in with a camera, and the nice thing about technology is I was then given the disc at the time to watch it, how it was all done, how they maneuver around, But again, point to note, insurance. Guess how much that costed me? It was in Harley Street. It costed £45,000. But thank God, Bupa was there, and Bupa took care of it. They paid for everything. Now, going through it, forget about medical. Now, relationship. You've been to England, you've been diagnosed with cancer. How do you break the news to your spouse, your kids, your family? That was also a big challenge for me. Having to tell my wife, my kids, Passedo, everybody will know how close we are. He was the worst of them all. Passedo is my best friend and more like my twin partner. So I remember after Saturday lunch, once I came back going through all this, I called him when we were taking a walk. So I told him, boy, boy, one prostate cancer. Huh? He nearly fainted. But I go, no, it's not a problem. I tried to explain to him, but this is something you need to watch about health. That it's not about just yourself. It's about the bigger family. Because once you are affected, you affect the whole family. So I went through the whole process, My mom, I told her, well, yeah, boy, the man operation she was very old at the time. My mom is late. So I tried to downplay it. It was only my wife probably who knew, and my sister and Passedo. My kids were still in university. So I didn't want to tell them, so I told them that, look, I am going for, a stomach ulcer operation. But kids, don't underestimate them. That's another story. They were living in Bristol, so I went through them, and in my briefcase, my medical records were there. So I sent one of them, the younger of them, and then somehow she took out my file and went through it. Now, after going through it, that's Yafatu, So when I left, I think I flew to Dubai. I was doing my business regularly. And then she told Yabajan, well, Dad told us that it's not. He's got prostate cancer. And then Yabajan broke down. She said, no, don't worry, I've done my research. I've gone through the internet. This was going to happen, da, 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 da. But they kept quiet, they didn't tell me. Now, lessons to learn. Lessons to learn is that always share your problems. Not only health. Always share it. I mean, that's something I've learned in life. A good example, one day we went to Joshua, at this age now, we own Guru, Taka, and so on. So a nephew of ours, was going for a wife. So I led the delegation and had a cousin with me. So we went there, and our Goro-to-be was ill for about 10 years or so. He had some skin problem. So when we went there, one of my cousins, who was very good in traditional medicine, told him that this is easy. This can be cured by using X, Y, Z. Anyway, long story short, within the next month or two, the man was cured. So don't ever hide your problems, and especially ailments. There's somebody, for example, today, if you're suffering from something, if you probably mention it here, somebody somewhere will solve it. There's always a solution to a problem. That's something you need to learn. The more you are locked up, the more problem you have. I mean, your chairman, you know how close I am, Alpha, and he quotes me on this. I wrote tell Alpha, I'm thinking aloud. When I say I'm thinking aloud, meaning that once I am processing something in my thought process, I share it. I share it so I can hear people's opinion. Somebody who's had a view about it. Somebody who's read about it in the internet. And believe me, most of the times, you will have the answers. So on that note, gentlemen, I am very sorry to tell you, but it is very likely that at this age bracket today, if everybody was tested, somebody will one way or the other have the symptoms or an enlarged prostate. Doctor, true or not? After I have heard it, still keeping the story, sorry, he's 16. I can add on, bonus, huh? So after I have heard it, I had very close friends who don't talk about it, who's had it also. I talk about it everywhere. I mean, because I do a lot of inspirational speaking, I take the opportunity to talk about it. So when it happens, I have had even some very elderly men, because I haven't spoken about the post-trauma. What happens? How do you now go through the therapies and, because some are shy, they will not even discuss it with their closest friend. But I talk about it because I think it's worth talking about. It saves a life. So after that, as I go in and out of the prostate center in London, I mean, the doctor who said, Mustafa, where do you live? I told him the Gambia. He said, look, if you live in London, we will hire you for counseling. Because you need to be counseled. In the Gambia here, I think I know about 4 people that I know directly who's also gone through the same thing. Some of them probably not the type of operation I went through, but one of them, Dr. Jai Pacha, had to call me into the hospital to counsel him because the guy would not go through the operation. And by now, he would have been lame. Today, he's alive, and we joke about it because it's a journey. At one time, ladies, you wouldn't know, but the ladies are around. You get padded up. That's the reality. Because incontinence, you cannot hold your pee. These are realities. Let us stop the stigma. There's no stigma in ailment. Any ailment that you have, it is not your own fault. You are just chosen by the Almighty that you will have it one way or the other. But today, there is no ailment, there is no sickness that is incurable. You can cure every ailment. And the best cure is early detection. So I want to see all of you by the time you walk out of here, that if we were to have this session by next month, you would have gone through this test. Please test for 3 things which are rampant. Cancer is there. So one is high blood pressure. I move around with my blood pressure machine. I've got the Omron that I carry everywhere. So every morning I check my blood pressure, and in the evening. Diabetes is common, and it's hereditary. It runs in people's genes, and also cancer. All these 3 can be hereditary. It runs in your genes. Once you are within the family, you are very likely to have it. So please don't be shy. If you want to live long, get in there and get tested. Thank you very much.
The speakers today, Dr. Bagi, Dr. Jam, and our businessman Tap, for the way they presented themselves. The examples from Tap, I think, is something that we all take home and understand that. But again, I thank Study Channel for taking this initiative. I've seen listed that about 80 countries celebrate Men's Day worldwide. But you will be surprised that anytime you say Men's Day, somebody will, oh, is it celebrated? People don't know that it did celebrate. And it's worth celebrating for issues like this. I am also glad that Dr. Bagi is here, because when I was told about this, I tried to scratch my head, because I said, well, this testicular cancer, I don't know why should be talking about that. So quickly I said, well, Dr. Bagi is here, I think he's the best person to talk about that. And I think I was glad. But like an old soldier, I've always tried to say, okay, how about if he doesn't come? I know he will come. So I tried to scribble something. I said, supposing I was there and I've told him, he didn't come, you have to come. I said, okay, I'll be prepared. But why I'm saying this is that when I went through some of these things, the extended version of non-communicable disease, testicular cancer, prostate cancer is a big ticket item. But there are others also, cardiovascular, chronic respiratory problems like the ones I have. I am constantly on sinus problems every day. And I think Babukar will tell you whenever we're on walk for house, he's always seeing me with tissue paper like I have now. I have to do it to clear my sinuses. But again, I am here because of that connection we have with Standard Chartered. That's Walk for Health. We initiated Walk for Health because as an old soldier, if that's anything like that, I have constantly been on exercises. But one thing that I take home is whenever I pass in the street, somebody will think, oh, I wish I could join you. Oh, I wish I could have the time to be with you. So I said, no, I think this should be taken out in the street so that everybody knows about it and join, and we make our effort and endeavor to encourage people to come and talk.
With regards to us human beings, men in general, we're being very prone to these kind of illnesses, for example, cancer and stuff, that we will actually have at a certain age. And these pharmaceutical companies, being a multi-billion-dollar industry, do they actually leave us dependent on these medications for the rest of humanity, I may say, just to make more money? Or are they like playing a 50-50 game with the scientists themselves, or not actually creating a cure to kill these illnesses for human beings to be free from cancer itself? So, on a business point of view, are these pharmaceutical companies just leaving us dependent on these medications for us to be there and then make more money? My second question is, I met with a white guy one day. He's a doctor, but he uses herbal treatment to cure malaria and other stuff. I can remember I was a taxi driver by then. So I had this conversation with him, and I told him that my dad passed away from prostate cancer. So he told me that there's a 50% or 90% chance that you might die from prostate cancer. Is that true, Dr. Bagi?
If you live long enough, you're going to get prostate cancer. And studies have shown again and again that men who are in their 80s, if you test all of them, you will find prostate cancer in 8 out of 10. And those ones are not hereditary. If you have a family member, and it has to be a close family member, a first-degree relative, who has prostate cancer at an early age meaning less than 60, then you have a chance of getting prostate cancer. But it's not even 50% chance of getting prostate cancer. That is way too much. Okay? You have maybe more than 3 times the general public. So if I don't have a family history, and somebody else has a family history, if my chances of getting it
1 in 7, then his chance in getting it maybe 3 in 7.
Thank you for taking time on your busy schedule to come and grace this occasion with us. And thank you, staff, also for coming out. I think a lot has been said here, and the theme is, let's take it home and share it. Remember, the life we save might be our own life. Thank you very much.